Welcome to this week's Healthcare Cybersecurity News Roundup from Heal Security Dispatch. For the latest sector-specific threat, risk, and alert intelligence, subscribe to our daily curated news and information service at healsecurity.com. According to a 2020 IBM report, there were 10 to 15 million connected medical devices in U.S. hospitals, an average of 10 to 15 per patient bed, which provide essential clinical care. However, in recent years, ransomware hackers have targeted such devices, from simple saline drips and IV pumps to complex MRI scanners and heart monitors, by threatening to prevent their proper functioning, with life-threatening consequences. The Protecting and Transforming Cyber Healthcare Act of 2022 now requires manufacturers to include cybersecurity safeguards that demonstrate a reasonable assurance of safety and effectiveness throughout the lifecycle when submitting new devices for FDA approval. The legislation obligates manufacturers to monitor, identify, and address device vulnerabilities, but healthcare providers must also tackle the most common weakness exploited by hackers: poor password management, and be encouraged to share intelligence on cyber threats, risks, and attacks on devices utilized in their facilities. A new report from the Ponemon Institute focuses on the impact of ransomware cyber attacks on the healthcare sector in the past 2 years, their effect on patient care, and what healthcare firms must do to mitigate the risks and damage that they cause. The report again confirms that attacks have increased, with 47% of contributors advising that they had experienced one or more incidents since 2021, that third-party data breaches were the cause of 46% of them, and that 67% of organizations were forced to make ransom payments. Most worryingly, 53% reported that cyber attacks disrupted the delivery of patient care. 45% stated that they caused complications to medical procedures, and more than 1 in 5, 21%, advised that attacks adversely impacted patient mortality rates. Alongside detailing the serious impact of cybercrime on the healthcare sector, the report highlights the need for an industry-wide forum to share intelligence on cyber threats, risks, and attacks, for cross-sector data and device security standards, and for firms to implement effective business continuity and disaster recovery plans. The U.S. Health Insurance Portability and Accountability Act, or HIPAA, is designed to protect against the unauthorized disclosure of patient-protected health information, and requires healthcare firms to inform HIPAA authorities within 60 days of discovering a data breach impacting more than 500 patient records. The latest HIPAA data breach report details 5 recent cybersecurity incidents in which the confidential medical data of almost 250,000 U.S. patients was compromised. The largest breach was caused by an external website app, but 2 others were the result of poor internal security procedures, including an employee illegally accessing confidential patient data. Another appears to have been a ransomware attack, but full details have yet to emerge on the second largest incident, which involved over 95,000 patient records. All 5 incidents again illustrate that the healthcare sector remains the prime target for cybercrime. Although the HIPAA data is undoubtedly useful, healthcare firms and their supply chain partners must upgrade their cyber defenses to include real-time intelligence on sector-specific threats, risks, and attacks on data, devices, and personnel. A new report from leading medical technology manufacturer Becton Dickinson focuses on the need for strong preventative cybersecurity practices and cross-industry collaboration to thwart cyber attacks. The company, which blocks 114 million intrusion attempts on its devices each month, advises that ransomware, phishing, and software vulnerabilities are currently the main cybersecurity challenges, as the number of smart connected devices grows and healthcare expands into more care settings, including patient homes. The report describes the firm's work with various cybersecurity working groups to advance secure practices, including ethical hacking exercises, cyber attack scenario training, and preparing for greater software bill of materials visibility. A statement on the Becton Dickinson website identifies the need to continually gather and share actionable intelligence on cyber threats, risks, and attacks to medical devices, stating that our customers cannot protect what they don't know. That's why we believe transparency and collaboration are essential. Orlando Health, a Florida-based nonprofit healthcare provider, has announced a new AI-based home healthcare monitoring system in a move that illustrates both the continuing growth of smart connected medical devices and the rapid advances that AI is making into modern healthcare provision. The Biformis system gathers and analyzes over 120 biomarkers to provide precise patient insights, enabling clinical care teams to proactively intervene and provide hospital-level treatment to patients. That same ability for AI technology to analyze data from disparate sources and convert it into actionable intelligence must be applied to healthcare cybersecurity to enable hospitals, clinics, laboratories, and individual physicians to proactively defend themselves against sector-specific cyber attacks, threats, and vulnerabilities. Moreover, as recent evidence has shown, firms across the healthcare sector, which remains the prime target for ransomware attacks, must enhance their cybersecurity protocols to encompass remote interaction to fend off the constant threats from cybercriminal gangs and nation-state bad actors on the security and integrity of patient records, medical devices, and clinical data. Thank you for your time. I'm your host, AJ. To receive the latest healthcare cyber threat, risk, and alert intelligence, subscribe to our daily curated news and information service at healsecurity.com.